be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're joined by Cristina Montoya. She's the owner and founder of the Arthritis Dietitian. She's also a person living with Sjogren's and rheumatoid arthritis. Cristina is passionate about helping women with Sjogren's and rheumatoid arthritis adopt a non-restrictive anti-inflammatory lifestyle while supporting their gut health. And she's here with us as we close out Sjogren's Awareness Month. Welcome, Cristina. Thank you so much for joining us today.
Thank you so much for having me here.
Can you tell us a little about the work that you do and something about your background?
I'm a registered dietitian in Ontario, Canada, and Colombia, South America, just to clarify that. And I'm the owner and founder of Arthritis Dietitian. I have lived with rheumatoid arthritis and Sjogren's disease for more than 20 years. And one of the things that I do is that I specialize in anti-inflammatory nutrition and arthritis-friendly eating to help individuals with inflammatory arthritis, especially those with rheumatoid arthritis and Sjogren's disease, in making informed nutritional and lifestyle decisions to improve their gut health, their quality of life without unnecessary restrictions.
Excellent. And can you tell our listeners a little bit about what Sjogren's actually is?
Let's talk a little bit about Sjogren's. So the first thing that you want to know about Sjogren's is to actually how to pronounce it. Let's start there, right?
Let's start there.
So the way I explain how to say Sjogren's, so just think about the TV show, and then grin. Can you say it for me? Sjogren.
Sjogren's.
There you go. You see how it sounds better?
Yeah, excellent.
So that's the first thing that I did. There was actually kind of what a few definitions of Sjogren's disease, because just until 2024, it was known as Sjogren syndrome. So I like the definition by the OMERACT Sjogren's working group, in which I've been participating as a patient partner for almost 2 years. Sjogren's is a systemic autoimmune disease that affects the entire body, along with symptoms of extensive dryness. Other serious complications can include profound fatigue, chronic pain, major organ involvement, neuropathies, and even lymphomas. 9 out of 10 Sjogren's patients are women, and the average age of diagnosis is usually 40. Although it can occur in all age groups. However, and I want you to keep this in mind, is that the Sjogren's is a slowly kind of progressive disease. So maybe you're diagnosed at 40, but you probably started to feel the symptoms 10 or 15 years earlier.
And what are those symptoms?
So the symptoms are typically, there is like this triad that they call it. Do you have profound fatigue, joint and muscle pain, and dryness? So there could be a little vague, right? Because many rheumatic diseases can present with similar symptoms. So how do I know? Like, is it Sjogren's? Is it fibromyalgia? Is it another rheumatic disease? I started to learn, right? Because for many years, I was actually diagnosed with fibromyalgia. But then along with that fibromyalgia, I also experienced like extreme dry eyes. And then there was some erosion to the cornea. So the ophthalmologist started to say, that's very strange. You're not on any medications that is causing dryness. The environment is pretty humid because I was living in Colombia, so we didn't have the dryness that we have here in North America. So he started raising some like red flags. It's like, this is not really normal. And what's interesting is for many patients, actually the dentist and ophthalmologists are the ones who start raising those red flags and suggest the patients, maybe you need to talk to your doctor and get assessed for Sjogren's.
Right. So, and then what happened?
Well, and then what happened is that something even more interesting, because with Sjogren's, it's more like a clinical diagnosis. My understanding, and even just from recently and attending the ACR convergence in 2024, there's actually not defined diagnosis criteria. What typically the doctors use to diagnose Sjogren's, it's based on the symptoms, the clinical symptoms. They may take some lab work to assess the presence of autoantibodies that are could be more specific to Sjogren's, although it could be up to 40% of the patients who don't even show up with those autoantibodies. They could use a lip biopsy to see if there's any lymphocytic infiltration that could suggest the presence of these autoantibodies. And typically, that's what they use to kind of fully diagnose Sjogren's. For instance, and I'll just share my own experience because I'm not a rheumatologist. I want to just make that clear. When I was diagnosed in Colombia, I was in my 20s, but actually my symptoms started when I was around 7 or 8 years old. And how my Sjogren's began as a child, it actually was different from how it presents with adults. So as a child, I have chronic parotiditis or like swollen salivary glands that even the doctors thought that I have recurrent mumps, like the viral infection. And that we know like an infectious disease that could happen maybe once or twice, but to happen every 6 months was very rare. But it's still, the doctors didn't know what was going on with me. So that was my first primary symptom as a child. Then around when I was 10 years old or so, I started developing dry eyes, so I couldn't cry. I was the kid who never cried. I couldn't swallow. I have very difficulty swallowing. I have a lot of digestive issues. My mom had to take me to the doctor almost every week. They still couldn't figure out what was going on. I had fatigue. My mom said that I couldn't keep up with my peers in sports or playing outside. I was the one that was picked last or not picked at all because I couldn't keep up with my peers. Sometimes I have trouble concentrating at school. And I lost a lot of weight when I was a teenager. So no one could figure it out. I went to multiple doctors. And until I was diagnosed with rheumatoid arthritis at 21, which presented very rapidly. My symptoms for rheumatoid arthritis showed up within 2 months. And within 2 months, I was already bedridden. So once the rheumatologist diagnosed me with rheumatoid arthritis, he started asking me questions about the dry mouth, dry eyes, and the swelling of my salivary glands. And he immediately said, "Oh, it sounds like Sjogren syndrome." I can see arthritis, my joints are swollen, but what is Sjogren's? So that's just how it started with children. And finally, on April 12th, I saw that the Sjogren's Foundation recognized the Pediatric Sjogren's Awareness Day. And I was so happy to see that.
So you're a dietitian. Are there particular foods that folks with Sjogren should look to imbibe or the opposite, avoid?
What I learned with Sjogren, so overall, we want to, for any rheumatic diseases, we want patients to eat an anti-inflammatory way of eating or think about the Mediterranean diet and how we want to include more of those foods with more antioxidants, more fiber, whole grains, fruits and vegetables, nuts and seeds. So all the principles apply to individuals with Sjogren's. What makes it unique, though, is that I always say, and I've been saying this for the past 3 years, that Sjogren's impact your entire gastrointestinal tract from gum to bum. Why? Because if your mouth is dry, Sjogren's impacts the production of saliva, not only in quantity, but also quality. And where does digestion start? It starts in your mouth with the breakdown of carbohydrates. So if you don't have enough saliva, that's when you start kind of getting trouble with Sjogren's and the way you start eating. So you start modifying the texture of your food. So maybe a healthy person, even a person with rheumatoid arthritis without Sjogren's, could eat a salad. But ask a person with Sjogren's and have, let's say, a kale salad. It's torture because it's a roughage, it's hard to chew. We don't have enough saliva to form a cohesive bolus to help it swallow. So then we tend to use or drink water or any liquid to push down that food that hasn't been properly chewed up. So it goes down to your stomach and the stomach has to work extra hard for it. So that leads to more heartburn and bloating. Then Sjogren's can also impact the motility. So I've seen a lot of patients, more than 50% of patients with Sjogren's present with constipation. So if you have constipation, then that means that you're probably going to feel more bloated. You're going to be more uncomfortable. So I find that the nutritional needs for patients with Sjogren's are actually very unique compared to other rheumatic diseases. So I focus on foods that are comforting for your mouth, starting with your mouth. So trying to avoid like citrus foods, for instance. But if you're going to have, let's say, some citrus foods, try to pair it with something that is more, has like less acidity, right? That you want to have like a plant-based beverage, or you want to have yogurt. So it's more comforting for your mouth.
And you should avoid kale, you said, and other leafy greens, or?
Just be careful with like the tough texture. So the tougher textures, not that you cannot eat it, then you can maybe modify how you cook it. So kale, you can maybe just use it in your pastas and then stir fry, that type of things. Just don't feel bad if you can't have a salad because, oh my God, it's so healthy. This is how I have to eat, but it makes me sick. It makes me literally sick. So what I teach patients is like, don't feel bad, like because you cannot eat the salad that everyone is promoting that you have to eat. Okay, there's other ways that you can add that kale. You can make it in a smoothie. You can add it to your soups. You can add it to your pesto for the pasta. And then your stir fry. You can bake it. You can make like kale chips kind of thing. So you see, it's about modifying the texture. That is that you don't have to follow kind of the typical type of healthy eating, and you can make modification, and that's okay too.
Right. Interesting. What about as a smoothie? Would that be helpful, or putting vegetables in there?
Yeah, absolutely. However, the smoothies can be like this, I would call it like a FODMAP bomb. So you're not familiar with FODMAP. So there's like the foods that are, or like high FODMAP foods, or like highly fermentable carbohydrates. And sometimes, like I explained to you, patients with Sjogren's can present more with irritable bowel syndrome that can be more sensitive to those types of carbohydrates. So smoothies are tricky. You want to make sure that they're not supercharged with FODMAP. So let's say you're going to make a smoothie with, let's say you add the kale and you add apples and you add seeds and you add those so much fiber into just one smoothie, then you're probably going to feel it within the next 3 or 4 hours, feeling super bloated. So what I suggest for a smoothie, and especially when you're not feeling a lot of energy to cook, so a smoothie could be a good alternative. But what you want to make almost like a meal in that smoothie. So yeah, kale, spinach is great. Those greens are great for that. You want to add some like berries that are not super high in FODMAPs and not to overdo it. So if you want to add some blueberries or you want to add some strawberries, maybe you want to add a little bit of banana. But if you add those three fruits, please do not add avocado because avocado will just be a bomb for it. Then you want to add a little bit of quinoa, like a cooked quinoa, like 2 or 3 tablespoons of cooked quinoa or 2 or 3 tablespoons of oats, just to add a little bit of carbohydrates, a little bit like a more soluble fiber to that smoothie. Add some plant-based beverage, a little bit of yogurt, and maybe a little bit of honey or maple syrup, some vanilla extract, cinnamon, and there you have your smoothie.
Wow. Well, thank you for that advice. That's good to know. So you're not just a dietitian, but you're also an advocate in the Sjogren's community. What inspired you to step into that role of advocacy?
I'll say I was an accidental advocate. I tell you, even though I was diagnosed in 2003, only when I came to Canada in 2015, it was the first time that I attended a Sjogren's conference for patients. And I couldn't believe that I saw like over like 300 people. Wow, more people have Sjogren's, not just me. So from that point on, I started looking more into my own experiences with managing my digestive issues. And I started connecting the dots. And then from there, I started running some like webinars for the patient support groups in Canada. I also started to attend more and more conferences. I even wrote an article for the Sjogren's Foundation for the newsletter. But I truly started being very, very active. I would say in 2022. I submitted a workshop proposal for the Canadian Rheumatology Association annual conference on the gastrointestinal manifestations of Sjogren's, and that caught the doctor's attention. Then slowly I started to expand that knowledge, and I ran some free webinars for patients on the gastrointestinal manifestations in Sjogren's, such as how to manage dry mouth, swallowing difficulties, heartburn, constipation, exocrine pancreatic insufficiency, And all of a sudden, I started to be known as someone who understands Sjogren's, not only from the nutritional standpoint, but also as a patient, because I've been living with this pretty much my whole life.
Interesting. Yeah. What are some misconceptions about Sjogren's that you try to correct through your advocacy?
Oh boy, there are many. There's an online forum called Smart Patients. I don't know if you're familiar with it, but there's a subgroup and an online forum that is specifically for Sjogren's. And Dr. Schaefer, who is behind the Sjogren's Advocate, and also Dr. Bexy Lobo, we all started asking questions like, what are these myths about Sjogren's that we just want to tell people that that's not Sjogren's? So I will tell you, I posted them on Instagram actually for this month because April is Sjogren's Awareness Month. Sjogren's is not just a nuisance dry disease. It's never just dryness. Just like I explained, Sjogren's can impact every organ and system in the body, and some manifestations of Sjogren's can be life-threatening. It's that we have a higher risk of developing like lymphoma. Some patients are really treated. I've seen patients with no treatment at all completely receiving disability benefits because of the manifestations of Sjogren's. So all these myths are part of what is called the Sjogren's elevator pitch that I mentioned to you. That was developed by Sjogren's Advocate in collaboration with the members of Smart Patients. It says that Sjogren's is not disabling, right? That's the myth. But the reality is that Sjogren is disabling. Many people have to change their career or even end their careers because of Sjogren's. It's not laziness. It's the disease that limits what people can do. Debilitating fatigue and pain often severely impact the daily life, unlike just the normal tiredness of your daily life. And it doesn't just improve with proper eating and proper sleep. Just go exercise. Those things are important, but that's downplaying the disease. When someone just tells you, just eat well, just exercise, and it really downplays the disease because the fatigue, I tell you, is so profound. It just puts you in bed and you have just energy for like nothing. It's very frustrating.
No, I could imagine. Well, thank you for taking the time to come on our program, especially during Sjogren's Awareness Month, getting the word out there as to the disease and some symptoms to look out for and how to take care for yourself when you have the disease is so important.
No, you're very welcome. I could speak about Sjogren's like 4 hours.
I'm sure. So now we have with us on the program Erik Stone, my colleague from GHLF. Erik, hi, can you share for our listeners what your role is at GHLF?
Hi, Stephen. Thanks so much for having me on this episode today. I'm Erik Stone. I'm the Director of Data, Learning, and Evaluation at GHLF. My job is to design education initiatives that meet the needs of our various patient communities. This involves everything from surveying patients to building those educational resources. Basically, you could say my job is to translate patient voices into action.
Excellent. What is the importance of staying up to date with community education and support needs?
I think that staying up to date with community education and support needs is absolutely essential, especially for a condition like Sjogren's that is often misunderstood. As Cristina pointed out, the way that I see it, the needs of patients aren't static. They evolve as new research emerges or as treatments change and as people's lives and challenges shift over time. So if we're not actively listening and updating what we offer, we risk giving people information that feels outdated or is irrelevant to what they need. Essentially, the how and the what of education have to adapt to meet the needs of the moment. Otherwise, we're speaking to yesterday's needs and not the reality of today.
And GHLF recently ran a survey about experiences of people living with Sjogren's. Can you talk about that survey?
We surveyed 148 people living with Sjogren's to better understand where there were possible unmet needs. A few key takeaways that stood out to us from this initial analysis. The first question we asked was, what information or resources would be most helpful to you? And managing symptoms and flares was the top need, with 84% of respondents selecting that one. Fatigue management was right behind it at 82%, and dry mouth and eye care tips were also highly requested at 82%. So I think this data shows how much patients are navigating the ongoing and frankly very disruptive daily symptoms, and possibly represents a need for more strategies that they could use in their daily lives. So one other thing is that if there's any Sjogren's patients listening now and this data resonates with you, we really would like to encourage you to also take this survey and share your experiences with us. And we'll make sure that's linked in the episode description for you. But Cristina, after hearing that more than 80% of the patients we surveyed indicated that they wanted more information on managing symptoms and flares, do you relate to this data? And if so, can you explain the impact of managing your symptoms and flares every day?
Yeah, absolutely. I do relate to that data, especially because there is not an actual definition of a flare-up in Sjogren's. So when you ask someone, what does a flare-up mean to you? So for some, maybe, oh, I feel this extreme dryness that it's just truly, I can't even eat or swallow anything. Or I have a mouth sores that they're very painful. For others, again, it's the dry eyes that they can't do. For others, it's just that profound fatigue. And it also can maybe shift different types of the year, right? It also, during this time of year when we have transitional weather, springtime especially, so we tend to have more flare-ups. So we definitely need more attention in terms of how to manage those symptoms in fatigue. Then keep in mind that probably some of us, like let's say 30% of us, may have associated diseases, autoimmune diseases. So we are, let's say, fortunate to be getting some treatment for those diseases, specifically like rheumatoid arthritis. But for those who don't have any associated treatments, I think they're the ones who are suffering the most because they're really struggling how to explain this disease to their friends, to their family, even to their doctors, because they simply dismiss them as, it's just dry eyes and dry mouth. Just put some eye drops in your eyes and then you're fine. Or just sleep well and eat well. So I think we need to pay attention, like the message that we're sending, and to provide support to everyone, not only those who present like the positive disease, let's say, on the lab work, but also those who are really suffering in silence, like those who are like seronegative patients.
Yeah, it makes me think back to the misconception you spoke about earlier with the level of disability that Sjogren's can often cause and how there's this misconception about how serious it is. So since I have you here right now and I spend all my time looking at data, but actually being able to speak to a patient is one other thing, what would you identify as the number one need of the Sjogren's community right now?
Well, I agree with Dr. Baer. Like I say, I wrote a blog post about his wonderful presentation at the ACR Convergence. And the patients are looking to improve the management of the daily symptoms such as fatigue, muscle, and joint pain, dryness, and neuropathy, right? Like that nerve pain. And for some patients are also being diagnosed with dysautonomia. We patients want to reduce flare-ups, and I think we want a targeted treatment that is just for us, right? For Sjogren's. We don't want to borrow treatments from other diseases. We might need to do that, but can we just have something that is just for us?
Yes, you can. So I want to get into that a little bit deeper, actually. What do you think needs to be done to meet this need? Is this something that there's stuff on the patient side that needs to be provided, or is this something that falls on the providers or the pharmaceutical companies, or where do you think the solution is to this need?
Let's start with the words matter. If you go to the American Rheumatology Association and in their website, they're still calling it Sjogren syndrome. There is a problem. It will still have these important sites that where patients go to or the doctors go to get the up-to-date information, but they're still getting outdated data, just that even naming the disease and the impact. So I think we start failing the patients just right from there because we're not giving the right education to the physicians who are supposed to take care of us. Another thing that is a burden to us, and I really don't like this message sometimes, as like you as a patient, you need to be empowered and you need to educate yourself so you can go out with your tools and talk to your physician. And I said, but why? Like I'm here look for help and for answers, and many patients actually go like almost you look like you're just a patient, right? Like you don't know what's going on. I'm your doctor and this is what's going to happen. So it's like always in this constant battle to prove what you have. So if we improve the education from the very beginning at the medical schools, and to really get physicians to understand what is happening with this disease, along as if you're teaching about rheumatoid arthritis and lupus, and even Sjogren's disease is showing to be more common than lupus. So why aren't we understanding that from the medical schools? Sorry, I just got passionate there.
No, I'm so glad that you said that. Education is never one person's responsibility. There is always a two-way street. And yes, I agree. It is so unfair that often that burden of staying educated falls on the patient instead of the people that are supposed to be providing the education. So I totally relate to your passion for that question. And just want to thank you for this entire conversation. Actually, this has been so insightful to me and really complimentary to the data we've already collected. And I hope we can build something that's really meaningful for Sjogren's patients.
Well, thanks, Erik, for continuing on with those questions with Cristina. And thank you, Cristina, for taking the time to be with us today. We look forward to more results from our ongoing survey.
Oh, thank you so much. And I'm looking forward to seeing all this wonderful work and potentially collaborate with you.
Well, I want to thank Erik and Cristina on another great episode of The Health Advocates. We'll drop links in our show notes to all of the mentions that Cristina gave us today, as well as to our ongoing survey for Sjogren's patients. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.